Welcome to Splendor Gardens, Mowe, Ogun State, a serviced estate, fenced and gated with paved roads and streets, 24-hour surveillance and security, and standard recreational facilities. Our strategically planned lots are for all classes of people, from the upper class to the young and upwardly mobile. Available lot sizes are 160 square meters, 220 square meters, 300 square meters, and 600 square meters. For more inquiries, please visit our website www.visgloterproperties.com or call those numbers on the screen. At Splendor Gardens, quality bingos with affordability, beauty, and serenity.
Hello, you're welcome. My name is Dr. Chris Williams. You are so very welcome today. It's so lovely to be able to come your way today again. I want to discuss something that I've never discussed in close to 20 years of doing this. Somebody contacted me with it recently. And I said, wow. In fact, that was the first time in my career as a health practitioner, natural health practitioner, that somebody will contact me with it. We only saw it when we were practicing full-time orthodox medicine, and then also we heard about it in medical school. That means to say it is not very common. But I decided to still talk about it because one person or the other, or somebody you know, may be able to benefit from it. Today we are discussing overcoming diabetes insipidus. Diabetes insipidus. Okay, some people will say diabetes insipidus, whatever it is. Okay, so not diabetes mellitus. Okay, there are two types of diabetes. Two types of diabetes. There's diabetes mellitus, which also has 3 different classifications, and there's diabetes insipidus. Okay, so as we discussed, you are going to be knowing the difference. Diabetes insipidus is rare. One person out of it occurs in one person out of like 25,000 people. One person out of like 25,000 people. It can occur at any age, okay? And the difference between it and mellitus, so there's diabetes mellitus and there's diabetes insipidus. Mellitus means sweet tasting in Latin. So diabetes mellitus is when the urine of the sufferers, if you taste it, it has some sugar inside it, sweet tasting. That's why ants gather it. Okay, in diabetes mellitus, there's high blood sugar. Okay, so the person has high sugar in their blood, and then this flows into the urine. So there's also sugar in their urine. That's the diabetes mellitus. But in diabetes insipidus, the person's urine is tasteless. The person does not have high blood sugar. But then they also urinate frequently, like as in diabetes mellitus. And they also have, they are also very thirsty because they urinate frequently. They are also very thirsty. So there's polyuria, which is excessive urination, urinating large volumes of urine. And there's polydipsia, which is excessive thirst. Because the person is losing water, they will be constantly thirsty. Okay, so there's polydipsia, there's polyuria, but there is no polyphagia. Polyphagia is the person will be eating a lot. In diabetes mellitus, there's polyuria, excessive urination, polydipsia, excessive thirst, polyphagia, excessive eating, because the person is eating, but is not able to make use of the blood sugar. Okay, the thing is just floating around in his blood. But in diabetes insipidus, there's polyuria, excessive urination, polydipsia, excessive thirsting, but there's no polyphagia because the person does not have sugar issues. Okay, that's different. So diabetes insipidus is this disease in which it's a rare disease and debilitating if not well managed, in which the person will be urinating a lot, polyuria, ever so constantly thirsty, polydipsia. They are not always hungry, but they are always feeling dehydration because they are urinating too much. I believe I've made the difference there. Frequent heavy urination, excessive thirst, overall feeling of weakness, normal blood sugar. Okay, so that's diabetes insipidus. Insipidus means tasteless. That's what it means. Another name for it is just like we say diabetes mellitus is sugar disease. This one we say it is water disease or urination disease. Okay, now what is the cause? Centrally, it has only one particular cause, and which can be led to by different things. But centrally, it has only one particular cause. So the particular cause is that there's a defect either in the pituitary gland or in the kidneys. There's a defect either in the pituitary gland or in the kidneys, and so it's either the kidneys are not able to use an hormone that is released in the blood, that there's an hormone that is released into the blood. The hormone is formed in the hypothalamus. Hypothalamus is behind the pituitary gland. So if it is formed in the hypothalamus, it is stored in the pituitary gland. And then from the pituitary gland, it is dispensed into the blood when there's need for it. That hormone is called vasopressin. Vasopressin. Vasopressin, released in the hypothalamus, stored in the pituitary gland, released when it is needed. What is the job of the vasopressin? It prevails against the kidney. It works on the kidney not to be able to filter plenty of urine or plenty of water out of the body. Your kidney filters between 120 to 150 liters of blood daily. The kidney filters between 120 to 150 liters of blood daily. And after it has filtered it, it forms from that 120, 150 liters of blood that it filters, it forms about 3 liters of water. 1 liter, 2 liters, 3 liters of water. Okay, filters about 150 liters of blood. So in other words, 150 liters of blood flow through the kidneys, from which it removes, separates about 2 liters, sometimes 3 liters of urine, and then the person passes it out. Now, it removes only that small amount the 3 liters from the 150, because the vasopressin is acting on it not to be able to take too much water out of the body. Okay, very important. Vasopressin acts on the kidneys not to be able to take too much water out of the blood. Okay, now when there is deficiency of vasopressin, either of the production or of the activity, it leads to diabetes insipidus. I'll say it again. Diabetes vasopressin is an hormone released, formed in the hypothalamus, stored in the pituitary gland, and then released into the body when it is needed. Now, its job is to work on the kidneys not to separate too much urine from the body. Okay? So after filtering about 150 liters of blood, kidney is able to only set aside about 2 to 3 liters daily for urine. When there is deficiency of production of vasopressin, or there's deficiency of activity of vasopressin. So the kidney just goes AWOL without control. And sometimes the kidney can form 15 liters of urine out of the blood. Now, when somebody is passing 15 liters of urine daily, that's a lot. The person will be constantly, persistently dehydrated and constantly, persistently thirsty. Okay, very important. Again, so the urine that is coming out is diluted. It's not concentrated. It's diluted. It is odorless. It is tasteless, and then it is also it is low in sodium. Okay, it is odorless. It is tasteless, and then it is low in sodium because it's not concentrated. Okay, no time to concentrate it. The kidney is just removing it, and then the person soon begins to be dehydrated. Now, so bottom line again, before I go on a break, is that there's inadequate vasopressin being released in the body or somewhere, and then it leads to the kidney over-functioning, as it were, and removing a lot of water from the body. And then the person will be dehydrated, always tired, always thirsty, and urinating a lot. Sometimes people who suffer diabetes insipidus can wake up to urinate about 10 to 12 times in the middle of the night. And that leads to all kinds of things. So I'll go on a break. I just want to encourage you. During the break, you are going to see the video of Splendor Gardens. It's a project of Visglotra Properties. Visglotra Properties is our sister company, and we are developing a wonderful estate on a 7.5 acres of land somewhere in Mowe. If you're interested, please subscribe or send the link to somebody who is interested. Tell them about it. Of course, the normal industry agency fee is there for you to gain from. Also, we have our books, and then Sex is Sweet. Enjoy It is still available. Make Your Food Your Medicine is still available. Causes and Cure of Chronic Diseases is still available. And then Reversing Depression Naturally is still available. All right, so do not forget to contact us. If you are watching this, just send me a WhatsApp message presently and say, I am watching the topic on diabetes insipidus. I will add you to our broadcast list, and I will send you videos regularly. So do not go away. I'll be right back.
Welcome to Splendor Gardens, Mowe, Ogun State. A serviced estate, fenced and gated, with paved roads and streets, 24-hour surveillance and security, and standard recreational facilities. Our strategically planned lots are for all classes of people, from the upper class to the young and upwardly mobile. Available lot sizes are 160 square meters, 220 square meters, 300 square meters, and 600 square meters. For more inquiries, please visit our website www.visgloterproperties.com or call those numbers on the screen. At Splendor Gardens, quality bingos with affordability, beauty, and serenity.
All right, you are welcome back. Today we are discussing overcoming diabetes insipidus. There are two types of diabetes. There's diabetes mellitus, the diabetes that has to do with inability to manage sugar in the body. Okay, and then that leads to excessive urination, excessive hunger, and excessive thirst. Okay, but there's another diabetes. It is not very common. In fact, the prevalence is 1 in 25,000 persons around the world. 1 out of 25,000 persons around the world have it. Okay, a diabetes insipidus. Insipidus means tasteless. Tasteless. So the urine here is tasteless. The urine in diabetes mellitus is taste sugar. Okay, so and so what is happening in diabetes insipidus is that the hormone vasopressin, which is released, which is formed in the hypothalamus, stored in the pituitary, released into the blood, the function of which is to regulates the formation of urine. It controls the kidneys from over-forming urine, taking too much water out of the body. That's what vasopressin does. Now, if there is inadequate of it, or the body, the one in the body, the kidney is not responding to it, it can cause diabetes insipidus. Okay. Now, so there are 4 types of diabetes insipidus. Number 1 is the central type, okay, which is because of inadequate synthesis of vasopressin. So in the hypothalamus, the vasopressin, enough vasopressin is not being formed, and then it leads to all the things that we have said. Number 2, there's nephrogenic diabetes insipidus. In other words, this one has to do with the kidneys. The kidneys are failing to respond. The kidneys are failing to respond to vasopressin. There's adequate vasopressin in the blood, but the kidneys are failing to respond to it. And sometimes it can be due to low potassium, it can be due to high calcium, it can be due to blockage or the other of the urinary tract by some medications. Number 3, there is dyspogenic diabetes insipidus. Dyspogenic diabetes insipidus. So there is a defect in the test mechanism. The test mechanism also is also located in the hypothalamus. So if there's a defect in the test mechanism in the hypothalamus, it can lead to diabetes insipidus. And things that can cause this are head injury, surgery, or some medications. And then there's a 4th one, gestational diabetes insipidus. Okay, and then okay, and so during pregnancy, sometimes there is an enzyme that the placenta releases, the placenta of the baby being formed. There's an enzyme it releases that leads to breaking down of vasopressin, okay, which eventually will lead to inadequate amounts of vasopressin in the blood. Now, if the production of this enzyme is too much, it can lead to symptoms and signs of diabetes insipidus. Also, if there's increased prostaglandin, it can also reduce the sensitivity of the kidneys to vasopressin. Okay, so this is very important. Now, the prevalence of diabetes insipidus, it happens in any age. It happens in any age, and when it's happening, sometimes in some children who refuse to outgrow bedwetting, sometimes they may be dealing with diabetes insipidus. Till they grow into adulthood, they are still bedwetting. Sometimes they may be dealing with diabetes insipidus. So what are the signs and symptoms of diabetes insipidus? Just like trying to go over it again, there's polyuria, excessive urination up to 15 liters daily, waking up to wee about almost 10 times in the middle of the night. The woman who called me recently told me that, and you know, my heart really went out to her. If you wake up 10 times to wee in the night, then you didn't sleep at all. You didn't sleep at all. You didn't sleep at all. So there could be polydipsia, excessive thirst, because of the drums of water leaving the body. The person will be constantly thirsty. Okay, it can lead to bedwetting, even in adulthood. Okay, because if you are waking up 10 times to wee in the night, and then before you sleep off, another urine has come, sometimes it can, you know, things can happen, and then the person can begin to bedwet. So, signs and symptoms. Okay, so we'll have polyuria, excessive urination. The person will urinate up to 15 liters of urine on a daily basis. And then the normal is supposed to be 3 liters. While the normal is supposed to be 3 liters, they are urinating up to 15 liters daily. Sometimes they wake up, unlike the normal person who wakes up to wee maybe once or twice in the middle of the night, they wake up to like 10 times to wee in the middle of the night. There's polydipsia, excessive thirst. They are just having to drink water. Okay. There's also, and that's because there's constant dehydration. Since he's losing 15 liters of water daily, he will be constantly dehydrated. There's also possibility of bedwetting. So bedwetting can be constant. It can be something that occurs once in a while. Okay. Then also sluggishness. All the following now are products of the dehydration and the electrolyte imbalance. There can be sluggishness, there can be fatigue, there can be dizziness, there can be confusion, there can be nausea, and then if care is not taken, there can even be epileptic seizures. Okay, there can be epileptic seizures. So, like I said earlier, there's electrolyte imbalance, and this can lead to muscle cramps, twitches, anxiety, frequent headaches, fever, joint pains, confusion, irregular habits, fatigue, digestive issues, and all that. Okay, so the person will have constipation, they will have all kinds of things because the electrolytes in their body are not balanced. Okay, so that is that. Now, so what are the treatments? What are the treatments? Number one, over there in the hospital, they will use some tablets. They can use a tablet called desmopressin, and then sometimes they can use some thiazides and all that. Okay, but that's left for doctors. It's so very important you don't prescribe to yourself. Make sure it's a doctor that's doing it for you. But some of the things you can do in order to support yourself are the following. Number one, eat a low salt diet. Okay, very important. Eat a low salt diet. So very important. Okay, because the more there is salt in your food, the more the more the kidneys will sieve out the water, or will filter will try to filter out the salt, and as it's filtering the salt, it's doing it, removing some water along with it. Eat a low salt diet, or even a no salt diet, but I'll recommend a very low salt diet, because if you eat no salt at all, you will also begin to have issues after some time. All right, drink plenty of water. Carry water about. So this kind of person, you may need to be able to drink up to 10 liters of water daily or more. Okay, very, very important. And then also eat a lot of vegetables. Eat a lot of vegetables, especially these vegetables that contain a lot of water, like cucumber, cabbage, carrot. Vegetables generally that contain a lot of water. Okay, the non-sweet ones, you can eat golden melon. Vegetables that contain a lot of water, eat them, so that they will be substituting the water level in the body. Okay, and then there's a tactics you can use of deceiving your mouth. You know, thirst, you hear thirst in your mouth. That's where you feel thirst. Okay, they found out that if you carry ice block all around, and then you take just one ice flakes, you put it in your mouth, and you are licking it, the coldness there and the whatever there, it will take some time before your mouth begins to feel dry again. Okay, so that way you deceive, because sometimes the thirst can really be, it can be distracting, it can be discouraging and all that. Okay, so you are drinking enough water, you are drinking water, but you can also use the technique of using ice cold blocks or cold flakes to deceive your mouth. Sometimes people have used things like aspirin or ibuprofen also, because this also help to reduce urine formation. They help to reduce urine formation. Okay, so change your diet. Eat water-full vegetables. Water-full vegetables, coconut water if you have access to it. Drink volumes of it. Avoid dehydration and in order to avoid it, you need to be taking a lot of water, and then also maybe avoid sun too much sun, so that you don't sweat too much, so that the source through which water is leaving your body is only through your kidneys. Okay, reduce your salt intake. We've talked about that. And then must your mouth regularly with ice flakes, ice block, and all that. All right, so when we come back, we'll discuss some more. All right, the video, the advert you are going to see during the break is the advert of Splendor Gardens. It's a 7.5 acres estate that we are developing ourselves and our sister company, Vis Glotra Properties, and it's located in Mowe. Promises to be a beautiful place, and then it's something that, if it's something that you're interested in, give me a call and let's talk about it. If you also know somebody that may be interested, help us tell them about it, and then connect them to us. You will, at the end of the day, get your referral agency fees. Okay, very, very important. Also, connect with us on social media. We're on Facebook, we're on YouTube, Dr. Chris Williams on YouTube, and then also on WhatsApp. Okay, so the number that is scrolling, you can send me a message on WhatsApp and say, I watched the episode on Diabetes Insipidus, and then we'll add you to our broadcast list, and then we'll be sending you videos on a very regular basis. Our books are also still available. Reversing Depression Naturally, Make Your Food Your Medicine, Causes and Cure of Chronic Diseases, and then Sex is Sweet. Enjoy it. We also do trainings. We can come to your church or to your office, wherever it is. We can come and train your congregation, your church members, or your staff. 1 day, 2 days, week-long training, specified trainings that will attend to specific problems in people. We can do that. Also, if you want to be trained by us individually, if you call, we do our training second week of the month. Every second Wednesday and Thursday of the month, we do our training. It's a paid training. You need to call in to know how that works. All right. Okay, so that's the how far we can go for today. Thank you so very much for watching. Till I come your way again. Bye-bye. God bless you.